The defibrillation electrodes come in a sealed pack and should be pre-connected to the AEDPlus. If they are not pre-connected, the AEDPlus will prompt you to plug in the electrodes.
Plug-in cable.
Make sure that the electrode pads connected are appropriate for the victim. Adult pads are labelled CPR-D pads. For children under 8 years old or 55 pounds, Zoll's paediatric pads should be used. Attached to the electrodes pack is a first responder kit. This includes a razor, a small towel to dry the patient's skin, and scissors for cutting clothing. A disposable face shield and gloves are also supplied for your protection. The electrodes need to be placed directly onto bare skin, so first remove all clothing covering the patient's chest. Tear open the electrode pack and unfold the electrode pads. The CPR-D pads are a one-piece pad designed to be easy to place. Using the sensor's crosshairs to guide you, align the CPR landmark between the patient's nipples and the middle of their breastbone. Press the CPR landmark with your right hand and pull the number 2 tab to peel the protective backing from the electrode. Press the electrode from the centre out to make sure it adheres properly to the patient's skin. Repeat the action on the lower pad, marked with the number 3 tab. If the patient is large, you will need to tear away the lower pad at the perforated line and extend it before pulling the number 3 tab. The pad should be placed on the side chest wall in line with the left armpit. Instructions on the electrode pack remind you how to attach the electrodes to the patient. Once the pads are applied, the AEDPlus will automatically analyse the patient. You should not touch the patient at this point, and the AEDPlus will remind you of this.
Don't touch patient. Analyzing.
The AEDPlus will determine whether or not the patient can be treated using defibrillation. If they can, then the AEDPlus will announce
Shock advised.
It will then warn you not to touch the patient and to press the flashing shock button.
Press flashing shock button.
Maintain a safe distance from the patient and ensure that neither you nor anyone else is touching the patient before you press the shock button.
Shock delivered.
The AEDPlus will confirm that a shock has been delivered and then advise you to start performing CPR.